Hello, I'm Dr. Janine Hopkins. As a board-certified dermatologist, skin cancer detection and prevention is one of my most important responsibilities. I recommend and routinely perform total body skin exams to detect skin cancer on patients of all ages. Early detection and treatment is key to curing the most common forms of skin cancer. Did you know that skin cancer is the most common form of cancer in the United States? Also, did you know that sunburns and sun damage in childhood increase your lifetime risk of skin cancer? Another scary fact is that tanning bed use will increase your risk of melanoma, the most aggressive of the three common skin cancers, by 75%. The three most common skin cancers include basal cell carcinoma, squamous cell carcinoma, and malignant melanoma. The names indicate the cells in the skin from which each of these malignancies originate. Are you familiar with the warning signs of skin cancer? Basal cell carcinoma, the most common skin cancer, often appears as a shiny, pearly, pink to red bump on the skin that gradually increases in size. The lesion may bleed easily with little to no trauma. Often patients say they thought it was a pimple or insect bite that just wouldn't heal. Squamous cell carcinoma is the second most common skin cancer, typically starting as a precancerous lesion referred to in dermatology as actinic keratosis. These precancerous lesions are rough, scaly, flat, pink to tan, usually on sun-damaged areas of the skin. Often patients say they notice that these places flake off but always come back again in the same place. Actinic keratosis represents areas of damage in the epidermal layer of the skin. Basically, the unhealthy cells are replicating too quickly because of mutations most often caused from long-term sun damage. If precancerous lesions occur in the mouth or on the lips, it can be the result of exposure to nicotine and tobacco carcinogens. If precancerous lesions occur in the genital area, human papillomavirus infections are likely the cause. Detection and treatment in the early precancerous stage can prevent progression to cancer. However, if untreated, squamous cell carcinoma develops in the tissue, eventually becoming an invasive cancer. If diagnosed at this stage, these cancers can be treated with surgical excision or certain types of chemotherapy cream. But if not treated early, risk for spread to lymph nodes, especially for squamous cell carcinomas on the lips, ears, or head and neck area, increase. The third and most aggressive skin cancer is malignant melanoma. These malignancies occur from mutations in cells called melanocytes, which make skin pigment called melanin. Melanocytes are located in the lower epidermis and in nevi, also known as moles. Even moles that have been on a person's skin all their life can mutate and develop into malignant melanoma. People with numerous moles on their skin do have a higher risk of developing melanoma. Other risk factors for melanoma include sunburns, tanning bed use, and a family history of melanoma. The warning signs include moles or pigmented lesions on the skin that are changing in shape, size, or color, or a new pigmented lesion that appears on previously normal skin. The ABCDE rules for detection of melanoma help outline changes to watch for. A is for asymmetry, so one side looks different than the other. B is if the borders are jagged, scalloped, or blurry. C is variations in color or changes in color. I look for black, tan, red, brown, or any combination of these colors that can be a warning sign. D is diameter, which really is mostly important if it's changing, so a lesion that was small and is now getting larger. E is if it's evolving, or elevation, as a mole that was flat and is now becoming raised. Any combination of these is often a warning sign. When evaluating patients and examining their skin, my goal is to find any lesion that could be a precursor for skin cancer or early malignancy, and not only detect but remove high-risk lesions and precancerous lesions. By removing suspicious lesions with what is referred to as a biopsy, a very simple procedure performed in our examination rooms with a small amount of local anesthesia, these precancerous or atypical lesions can be diagnosed and proper treatment initiated. Hopefully this information has helped educate you on the 3 common forms of skin cancer. And let me finish by encouraging you to practice sun safety every day by applying sunscreen, daily topical antioxidants to exposed areas, and of course wearing sun protective clothing. Also, please consider having a thorough full body skin exam, as early detection is your best defense. Remember, it's important. Be healthy, be beautiful. Hopkins Dermatology.